Opioid Council. It looks like we are being recorded for the public's viewing, and the agenda includes just what our calendar looks like here in the short term. Robin, did you want to review that, or is that just for information purposes?
Well, I think we'll go ahead and hand it over to Kelly. We had to make some adjustments to the agenda as we invited our state partners who are going to go first. So I think Kelly does have some of those updates to start us off, and then we'll move it over to the state.
Okay, sounds good.
All right, thank you. I'll go ahead and share my screen here. Whoops, off center there. All right, so welcome again to the September meeting of the Boulder County Opioid Regional Council. I'm going to start with just a quick recap of our virtual meeting guidelines as well as our agenda for today. So as a reminder, this meeting is open to members of the public. However, it is not a public hearing, and so we are not looking for public comment. If you do have any burning comments, questions, concerns, feel free to add them into the chat, but please be aware they won't be a part of today's dialogue among council members. Our agenda for today, I'm going to start with just a few brief updates that are more general in nature. And then hand it off to our guest speakers, Jamie Feld and Jack Patterson from the Attorney General's office, who are going to give updates more specific to the work going on at the state, and then open up for discussion and questions from the council. I will also provide an update on the conversation that we started in August around continuation funding. So as a reminder, we talked about some of our short and long-term planning, with the short-term focus being around what do we need to understand in order to continue funding for currently funded programs. So provide an update on our method there, as well as our update or an update on our method for starting the process of determining some longer-term strategies as well. So with that in mind, general updates. So we had mentioned in our August meeting that we were, there was a September 15th original deadline for regions to submit their allocation or their funding plans to the state. We were really thinking at the time that there might be a November date for plan submission added, and we do know now, it's been confirmed, November 15th is an additional plan submission deadline that's been added into that calendar. And so that is the date that we are striving for in order to submit Boulder County's regional funding plan. So what this does to the short-term calendar, this is going to look primarily the same as what we had talked about in August. Really, this is sort of a recap. Our focus from now until the end of October is really to hammer out that continuation funding process and make sure that we're getting our dollars out the door to any of the currently funded programs that are still needing dollars to sustain their abatement strategies. Also now and then until that November 15th deadline for submitting our plan, we'll be doing some additional work to identify and allocate some funding across the 3 categories in the cost online system. Again, that's prevention, treatment, and other uses. And then from that deadline of the 15th of November through to March 15th, we'll be doing sort of that extended planning process, the longer term strategy development. We'll be working with the community more closely. Our contractor will be on board, and we'll have an expanded operations group roster that taken together are going to help us identify what those regional priorities are. And then by that March 15th deadline, if anything has wildly changed from our original plan submitted in November from our subsequent planning process, we can make those amendments and move dollars around by that March 15th amendment period. So before I hand off to Jamie and Jack, any questions about the short-term calendar? I know that's kind of what we had talked about in August, but. All right. Well, with that, oh, did I hear someone?
Kelly, I was wondering if we could do introductions.
Oh, absolutely. Sorry.
Before Jack and Jamie start their conversation, and I think many of us have already been introduced, but just to make sure that they know who's all here.
Absolutely. Sorry about that. Do you want to kick us off?
Commissioner Levy, do you want to start?
I'm happy to do that. I'm Claire Levy, Boulder County Commissioner, and I am the Commissioner's designee to this council. Lexi, do you want to go next?
Hi, Lexi Nolan. I'm the Director of Boulder County Public Health. Robin?
Hi, everybody. Robin Bohannon with Boulder County Community Services. I'll hand it over to Miranda.
Miranda Fisher, Town Administrator for the Town of Nederland. Jim.
Good morning or afternoon, Jim Adamsberger, Community Services Department. And I'll pass it to Kelly.
Hi there, you know me, Kelly Veit, Community Services Department at Boulder County. And I will pass it to, I can't see everyone because I'm screen sharing, so I apologize, but I know Tucker's here.
Thanks, Kelly. Good afternoon, everybody. My name is Tucker Yerman. I use he, him pronouns. I'm staff support from the Community Services Department on the Opioid Abatement Project. And I think we have Sheriff Johnson still to introduce himself.
Curtis Johnson, Boulder County Sheriff, and I don't know who's left.
I think we got everybody. Did we get everybody?
We got to have Barb introduce herself.
Good afternoon, everybody. Barb Halpin, facilitator of this meeting.
Thank you, Barb. Okay, Jamie or Jack, do you want to take the reins?
Sure. Can you hear me? All right.
Yep.
Perfect. Okay. Hi, everyone. I'm Jamie Fell, Director of Opioid Response at the AG's office. I recently moved into this role. Previously, Heidi Williams was our director and I was deputy director. Recently became director as of August. I'm very honored to be in this position, and also a thank you to Boulder County, where I consider my roots, where I worked for 5 years, and it's just lovely to see folks that I know and that I also just know the hard work of you all here. So I really love the opportunity to connect with Boulder County directly. I often mention Boulder and the great work you're doing. So next slide is just to show our team. We do have a small team that is administering these funds. Myself as the director, we have Jack Patterson here, and I'll let him introduce himself in a moment. He is the person behind the opioids@coag.gov email, so ensures that we are accessible to the public, to regional council members. Any questions you have, he is able to provide really responsive regional technical assistance, and we're really fortunate to have him on our team. I always say, don't steal him from us. He's a gem. And then Robin Stoyer, our grants coordinator, who manages our infrastructure and innovation grants, that I'll talk about a little bit later. And then 20% time is Mindy Baumgardner, who is a rural outreach specialist. She covers opioids as well as other topics. And Jack, if you want to unmute and just introduce yourself briefly too.
Thank you so much. I'm Jack, I'm the program assistant with the Opioid Response Unit, and it's a pleasure to kind of get to work with you on. In my previous role, I got to help support some of the Miracle programming with Boulder County Community Services, and so it's just exciting. I'll share Jamie's sentiments and my appreciation to all the great work you all do. So thanks again for having us today.
Thanks, Jack. And then our next slide just shows we were asked to bring up the Colorado Opioid Abatement Conference and key highlights. We're grateful for those of you that attended. We did have the representation on our panel, which was excellent, from Boulder Valley School District and also from Boulder County Community Services, Jim Adamsberger, and the AG spoke with the representatives. We had over 200 people in attendance in Montrose, which is a distance to get to, but really excellent to highlight rural Colorado, representatives from all 19 regions across the state, and then attendees included elected officials, community leaders, law enforcement providers, affected family members, and I think Jack added this, but one dog too, so you can see a very friendly dog there. But really, it was an excellent opportunity to connect, talk about best practices in the state. We are thinking that for next year, we will hold it more along the Front Range. So we would love to have more folks from Boulder County. I know Boulder County Public Health was also in attendance too through Georgia. So really helpful to have people there. So we can also share out the good work of Boulder County. Next slide is just some pictures from this. And I would also offer up, if anyone that attended would like to share key highlights that they had from the conference. If you go to the next slide, we did do a survey afterwards, and this was some of the feedback that we received. We also want to offer up, if any commissioners or elected officials want to meet with the Attorney General or us as staff, we welcome, participation with elected folks, with directors. We did have some other commissioners attend, and so happy to meet with you separately too if there is ever any questions or you're not able to make it all the way out to Montrose, which definitely makes sense with all of your various priorities. Any feedback from those that attended?
I'll just say I thought it was a great conference, and there was a lot that I was able to take away from the presentations. And I think some of the key takeaways for me was that many of the communities, many of the regions were experiencing the same kinds of things that we are, which is that this is a complicated process. It's a pretty heavy lift, and there's a lot of infrastructure that we need to build to move this work forward. So I think that helped to kind of tamp down some of our anxiety around how much work this was to get stood up. But also, I think in terms of service delivery, the key importance of peers came out very clearly. Looking at the Johns Hopkins criteria was also something that was very helpful in terms of looking at guidance. And just really the opportunity to network with people was great. I made a lot of old connections and new connections. So I really appreciated the opportunity to be there.
Great. So yes, it was great to have Jem and also your representative from Boulder Valley School District. Boulder Valley School District actually sat on both Broomfield and Boulder, which we always love to see interregional collaboration and appreciation just that you participated in our regional council discussion. So there was a discussion about regional council formation process. I really see that Boulder really has the opportunity to be a leader, especially on a variety of areas, but one came to mind around the lived experience voice. And so I think some of the work you've done in the past around lived experience voice will be great to see as it moves forward. Next slide. So it looks like it maybe got a little bit messed up in the translation to this, but basically the takeaway here is that over the course of these 18 years, there is $770 million that is coming to the state of Colorado. That's up since the last mention that we had, as there was a recent $70 million Kroger determination in principle. And so from pharmaceutical companies, manufacturers, even the consulting company, we are seeing this money to the state over 18 years. We'll talk a little bit more about Boulder County's amount specifically. Next slide shows how the shares are allocated. It's just a reminder for anyone that's new. 20% goes by direct allocation to local governments. In Boulder County, all of your local governments are diverting their funds to the region. 60% goes directly to the region. So right now, with all of your local governments giving the money to the region, 80% goes to directly there. We have a 10% infrastructure share. So this is really intended for the most hard hit areas of the state with resource needs. And then we only hold 10% at the state government. All these funds are requiring full transparency, and we do have our dashboard, which posts the information online. Next slide. So as you already know, we have 19 regions in the state. Boulder is its own region. One item that we were encouraging is thought around interregional collaboration. So as you move forward, if there's options for partnering with other regions, we know it's challenging. It's challenging to partner within one county. It's challenging to create a new regional council. So this is kind of a long-term vision around, as you're identifying needs, perhaps around infrastructure or around even, youth substance use was one of the facilities we heard. Considering the funds that are coming to some of your partners, such as Denver, Adams, Arapahoe, and we want to help facilitate those conversations as they're needed too. Next slide. I'm going to go just pass through this because Kelly already talked about the timeline. Next slide. And Jack, is there anything you want to bring up on this part? I know that Kelly and Jim have been our contacts here and have been very responsive to all the needs and requirements for the regional council. Is there anything in particular you want to bring up, Jack?
Yeah, I'll just very quickly note, I think the intent of the MOU is to really give regions flexibility to continue to kind of figure out what is that best strategy. And so I think just that you guys can continue to amend those plans. And then just as we get closer to that expenditure reporting, you'll need to certify compliance with that. And so it's, we just want to continue to work with you all and make sure this works for you.
Great. And we are working on some technical assistance resources too, to help support you as you get closer to expenditures, certifications, and we'll provide those to Jim and Kelly, and happy to come back for a follow-up presentation as needed. Next slide. And my apologies, the font I think just looks a little bit off with this, but it's not a problem at all. The information is all there. Next slide. So we wanted to share with one of the funds is an infrastructure share. This is 10% that comes through formula, or not through formula, but through our MOU structure. It is overseen by the Colorado Opioid Abatement Council, focusing on capital improvements and operational assistance. When the Colorado Opioid Abatement Council talked, they really talked about this in some ways going to rural and underserved communities. And I think the rationale was just that if you look at the percentage and the dollar amounts that are going out through the state, some concerns about what rural communities were getting. We know that urban areas are also underserved in many ways. So, if you do make an argument around underserved, particularly for a marginalized group, but I do think that the COAC has really, in their interpretation, looked at rural. So it's just something to keep in mind when you're trying to decide where to spend your time on granting. Let me know if there's any questions on that. Okay, the next one is our Opioid Abatement Innovation Challenge. So yeah, infrastructure share, we've launched 2 rounds. The second round was recently announced at our conference. We'll have the third round starting in November. Innovation Challenge, we had our first round, $4 million. It was opened and closed on June 30th. We're in the process of reviewing those grants. They will be notified shortly about it. I would say we had such a high response and interest in this. We had 65 applicants, which totaled $44 million, and we only had $4 million to give out. We do anticipate that we're going to do follow-up rounds of this, particularly starting next year, early next year. So if there was an applicant that did not receive funds, I don't want that to discourage entities from applying in the future. We have these funds over 18 years. And we know there were some really great applications, but it just wasn't possible to fund them all, as there were, the 44 million and only 4 million that was able to give out. So we thought there were, like I said, excellent applications. And so if folks did not receive funds, we don't want that to deter them from applying again.
Jamie, this is Robin. I have a question related to both of these funds. When I looked at the awardees for the infrastructure grants, I was struck that many of the projects seemed broader than just opioid response. And I'm just wondering if you can comment on that in terms of what would be allowable if we're considering other substance use issues, or I noticed one included like transportation. I just would love to hear your perspective on that.
Great question. So when we do talk about opioid response, we do include other substances. So it doesn't have to be just opioids only. It just cannot not include opioids. So if there's a treatment program that provides services for opioids and other substances, then that would be allowable, with the understanding that, it's sometimes very difficult to identify, like a single person may have opioid use disorder as well as stimulant use disorder. They're very likely linked. And so on our end, we're not requiring that you track, for example, the percentage of time that is specifically for people with opioid use disorder, if it's broader to substance use. But it couldn't be a program, say, if it was just alcohol only and did not include opioids. That was some information that we received from our legal counsel. I will say too, that thinking about prevention, some of the programs are a little bit broader, knowing that, you know, pro-social activities are really a mitigator for not just opioid use disorder, but other substance use disorders. And so looking at at the evidence, sometimes it is not substance specific. That is really a good evidence-based tool to get to the same outcome. So I would say that there is some broadness. You do have to still connect it back to opioids. So with the transportation, you know, they talk about transportation to substance use treatment facilities. You couldn't use it just for transportation, like we say, getting a law enforcement vehicle. It couldn't be used, you know, just 5% of the time, 10% of the time for substance use services and 90% of the time for other things. But I think that there is a way to look at it in a little bit broader, especially around prevention, which we know doesn't always need to be substance specific.
Thanks for that. And that's true of the settlement funds in addition to these specialized grants that you're managing.
Exactly. So what we base it off is something called Exhibit A in Colorado and Exhibit E at the national level. And those do go through allowable uses. And so you can kind of see specifically what those are. I think your team is aware of them. We use the same for these grants. And that is the guide. And you'll see within there's things like, programming for women with substance use disorder, SBIRT, which is a screening, brief, intervention, referral to training, which is for all substances. So you will see in that list that they really do even specify things that are a little bit broader than just opioids. I would say too that, probably a program that is just mental health, like say just suicide prevention, would not be allowable with the funds. So something that is just like suicide prevention that has no connection to substance use would probably not be allowable. And we're happy to provide some more guidance if there is any questions.
Thanks. That's very helpful. You may be aware that we just completed a behavioral health strategic plan. And so there will be projects and implementation of the behavioral health work, which includes, of course, substance use. And so there's been talk about how to leverage all different types of funding, including the opioid settlement dollars, in implementing that work.
Great. Yeah, I think that would likely be in alignment, depending. Yeah, the specificity. Yep. Great. And I do think one thing that we saw from Boulder County, which we haven't seen from all regions, is that the funding of smaller nonprofits. We know sometimes it can be harder to do that burden through procurement, but we're hearing best practices nationally is that not excluding nonprofits because of the challenges in getting the money out to them. And so I think that's one thing that is kind of a success out of Boulder County. And we know it takes extra work. Next slide. As mentioned, all of our information around the funds, where they're allocated, is available online. We're one of 3 states that does make this publicly transparent. If you go to the next slide, you can see even for Boulder County that, and again, online, it looks a little bit less wonky than it does here. You'll see Boulder County is up here. It will show your most recent plan. So it shows the most recent one. It shows how much money you have available September 2023. And then it shows the total funding over the course of the 18 years, which is around 30 million. So that is something we have available, but it's also good for you to know that anyone is able to access that information. And then it shows the region's contacts. So we keep in touch with you all. If there are ever any changes to the regional contacts, we would like to make sure that this is updated as well. Eventually, we're hoping to have a website where we could link to the region's web pages too, because I know you all keep that updated. And so we could just link directly and folks can go to there. Another item that is coming out of the national best practices is the transparency for, open meeting laws, as you all do, of having these posted and available for the public is something that the national watchdogs are looking at, something we're trying to, ensure we follow at the state level. And if you have any questions, your best contact for open meeting laws is always the Boulder County lawyer. But I think, just the fact of you guys having a website and having the information posted about the meetings is really great. Next page. Just quickly, I wanted to mention that out of the Colorado Attorney General's office, we launched something called the Connect Effect. It's a prevention awareness campaign targeted to youth ages 10 to 14, secondary youth ages 15 to 18, and then also for both their parents or trusted adults. It really is, our hope is that it's evidence-based around positive social norms, fact-based information, how to be an active bystander, and to normalize conversations and decrease stigma. Focus groups were held throughout the state. Next slide. And you can see some of this is just information for parents about how to start the conversation about pills and fentanyl. We have information in Spanish, and we are looking to find some pilot communities that we could give many grants to share this information out. So we'd love to think through Boulder County, and if there's any interest in one of your communities receiving a mini grant around getting this out. Next slide. You can just take a screenshot here. This is all of our resources, social media. It could be good as you're thinking through the possibility of the mini grant, seeing if it's something that you feel like would resonate with your community. Also, the vendors said that they are willing to help customize it to your local community as well. So that they're a Colorado-based vendor, SE2, that they're very interested in figuring out if there is any tailoring or the statistics need to change for a local community, that they would be willing to do that. Next slide. So we are just following some of the things that Kelly and Jim said would be helpful for you all. One item we wanted to bring up, and I can apologize that the screen looks hard to read, is around this John Hopkins Award. The Colorado State received the inaugural award for excellence in the application of opioid litigation principles. So we really have to thank the partnership with local government for being able to receive this award. We were the first state to receive it. Now they're looking at giving these awards also to local entities as well. So it might be something to consider as you're developing your work, whether a goal could be a nomination or receipt of this John Hopkins Principles Award. Some of their principles are spend the money to save lives, use evidence to guide spending, invest in youth prevention, focus on racial equity, and then develop a fair and transparent process for deciding where to spend the funding. So those are some of those principles. You can go to their website, and we can put the link in the chat too. I think Boulder County is really, on board with a lot of these pieces around evidence and youth prevention. We are trying to figure out at the state around this fair and transparent process. We're trying to figure out ways to, more actively incorporate the voice of lived experience. Again, the part about open meetings or how to make it as transparent as possible. We're also trying to do more work on racial equity. I think that's an area for us at the state to work on, and how we can incorporate maybe a community responsive, culturally responsive grant at the state. So I think there's still a lot for us to do on that. And then the part about spend the money to save lives, I think there is a focus on that part about harm reduction. We are getting, just as a caveat, some questions around what is the appropriate role of law enforcement in this. And so some states are interpreting it differently. Some states are not determining that side activities like interdiction is an allowable source. So that's something to consider, that from these national watchdogs, I think there's a lot of scrutiny around using the funds for more on the interdiction or supply side. Next slide. So we invite any regional council members to our learning forums. Jim and Kelly and Tucker have all been great at participating. It is open to you all as well if you ever wanted to participate. We give updates and then also hear from regions. Eventually, we might want to highlight Boulder County and some of the successes of the work you're doing. So these are the ones that are upcoming. And within we have our email too, if there's any questions at all or concerns. We want to be a resource as much as possible. So if there's regional technical assistance or you need help connecting to another region, one item we're also working on is data. So we have a data work group at the state level to look at, are there state indicators eventually that we could put into an RFP? That was a request that came from the regions. So if you want to get involved in any of these efforts, just reach out to us. We are more than happy to get you connected, and we appreciate all your leadership and work on this. It's great to see the money going out the door. I think that's the last piece that I think at the AG's level, he's often looking at is, is our communities able to get the money out the door? If not, what are the barriers? Also, another best practice we're seeing is some communities are putting out press releases when they put their announcements out, and that helps with awareness. But if you have any questions about what we're seeing in other communities, don't hesitate to reach out. Great. Well, that's it from us. Again, it's Jack on our team is amazing, responding to our opioids email. You can sign up for our newsletter too, and that shows when the new funding announcements are coming out. Also, we'll share out information about, for example, the Johns Hopkins. I do see Boulder as being able to be one of these like nationally recognized recipients. So I could see that as a goal for this group. And then finally, just appreciation to Kelly and Jim and Tucker for their work, and all of community services for spearheading this effort. Questions?
I have another question, but I don't want to hog the time, and if other council members have questions.
I do have a question. Thank you, Jamie and Jack, for your work, and also really for recognizing the work that Boulder County is doing. I'm proud of how hard we're working to be transparent and to meet those principles. I'm curious about the Connect Effect program, and under whose auspices you would typically see something like that administered. Is this best thought of as a public health program? Is it something that belongs in the schools, or who would you see being a prime recipient of a grant in that area?
Yeah, that's a great question. I think at this point, we want the information to get out as widely as possible. So all those materials are free of charge. So really anyone can use them. So I think all the places you listed are really excellent. The materials, we can send them out to communities, are all free of charge. There are social media, so there's no cost to using it. It is a public awareness campaign. So it's not like an intervention where you sit down with a teen and it has to actually be in a particular setting. So I think schools, public health, community services, we have both youth and trusted adult materials. So those might be slightly different, but I would say as broadly as possible. And we're open to innovative places about where we could partner. In terms of the mini grants, they're fairly small. So they're just around $5,000 we're thinking for these mini grants. And it's limited to just sharing out the materials. I again think all those partners could be key. If there is a partner that's interested, I think it's more around the readiness and willingness of that group to participate and kind of be a pilot. This is the first year. And so anyone I would say that is interested, we are open to talking with. And I think there could be more than one from Boulder County potentially in this first pilot round. We don't want to cause competition unnecessarily. We really want the money just to go out, or the money, also the information to go out as widely. So very open to hearing who's interested.
Yeah, thanks for that. So I gather from what you said, it's a set of materials, and you don't need a facilitator. You don't need somebody to actually walk someone through them and train someone in how to, how to implement appropriately.
Exactly.
Yeah,
Exactly.
that's great.
It's a fairly small lift, I would say.
Okay.
Yeah, but anywhere you think of, there could be areas we're not thinking of how to get to trusted adults. The target is really youth 10 to 14 and trusted adults. So any entity that reaches those communities would be a good partner. Other questions?
Yeah, I was wondering, our council has, for the last couple of meetings, and it's on the agenda today as well, is how do we move from sort of a really focus on tactical issues to get first investments out to more strategic conversations? And we're bringing on a consultant to support that effort, but I'm wondering if you've seen anything from other councils that has helped develop that work for the council in terms of really thinking about our community and what we need, and then how we want to be more strategic about the funds, including engaging the public about the funds. So that was my question.
Yeah, great question. In a lot of ways, I think in terms of planning, Boulder County is definitely a leader. And so I think your previous work, having done, with your behavioral health, I'm going to get the word wrong, roadmap, your community health needs assessments, I think that you're the substance use advisory group, of course, like you have actually a lot more in place to start with. So I think that's the first thing we have seen, is that utilizing existing planning, strategic mapping as a starting frame, just because of the sort of overwhelm people get with planning too, that I think it's helpful to not start from zero, especially with you all who have done such great work. So I think that's the first step. Some places like Larimer County, I know, they actually have a position in their regional council, which is like an application for a person with lived experience. And it's like it's a competitive application. And then there's people that vet who might be sitting in that role. So they have more than one person. So that's one thing that Larimer County has done. For community health needs assessments at the national level, I can send a couple of different examples that John Hopkins is Shatterproof has shared with me about how to go about it. And some are at the county level, so I can definitely share those. And then I think too, figuring out state data resources. So we can also help you with this, but getting some of those state data indicators. We do know that there's a lot already available at CDPHE that you can pull from. So happy to help facilitate that to the degree, and I'm sure your facilitator could as well. Let me think if there's any other pieces. I think compensating people for lived experience, we've heard that's something we're still trying to work on. And then, including the voice of folks in recovery. I do think, like I said, I think you all are in a better place for that long range planning. And in many ways, we might look at you as the model as we share out to others. And I think the last piece is there are a couple resources we have. One is that Exhibit A, which does show the allowable uses, which is good to draw on. And then another one is something called the Colorado Blueprint, where you can, as a group, look at the main areas from prevention, harm reduction, treatment, recovery, and use that as like a tool. And they actually have a tool where you could score what percentage you'd be giving to each focus area. So that's one more tool. So happy to work with your facilitator. There are several other facilitators in the state that have gone through this. And, but I do honestly think that what works for your communities might be a little distinct, like knowing how many educated, smart people you have in Boulder County working on this. I think you've got a good starting place.
Thank you. Any other questions for Jamie or Jack?
My last comment in terms of planning is we put those numbers out, but that's really a baseline. And so when you're thinking about planning, not to think about those numbers as really specific down to the dollar and cents. We anticipate, there could be future settlements. We have not included in those numbers the Kroger settlement that's in principle. So when you are thinking about planning, you might want to consider how it could grow too, versus just the amount that you currently have.
Okay, I'm not seeing any other questions. Jack and Jamie, thanks so much for your time and for the presentation. It was very helpful.
Yes, of course. And thank you, Robin. It's great to see you. It's great to see others from public health and the sheriff's office, Curtis, Johnson. It's nice to see you all, and thank you all for your work.
Thank you. Good to see you.
Oh, thank you.
And I'll just chime in here and thank you, Jamie and Jack, again. I will take responsibility for some of the wonkiness in the slides. I think the translation as I merged our decks caused that, but I'll make sure that they're fixed. So by the time we hand those out to folks after the meeting, they won't look like that. So apologies.
No worries. Kelly, I think we'll hand it back to you.
Sure, okay. Keep it moving forward here. Okay, so we're going to change direction a little bit and talk about continuation funding. As I mentioned, this is sort of what we were thinking through when we proposed both a short-term and long-term funding plan in our August meeting. So we've had a little bit more time to develop some approach and methodology around that. This I just put up to kind of recap. This was presented in August, and it sort of shows everything the council approved in terms of everything short term is sort of in pink, really focusing on how do we get dollars out to sustain currently funded programs, how do we ask or raise sort of our larger priorities as a region, and then how do we fold both of those together into our general allocation plan due November 15th. The longer term vision then overlapping starting in November, really starting that longer term process around identifying gaps, needs, priorities, fusing in community participation, and then anything that comes out of that process will be added to amended to our plan in March. So where did we go with this conversation around continuation funding? So really the background for our decision making here, or our rationale, was in our first year, our funding agreements were relatively light on reporting requirements. So we didn't have a ton of outcome reporting that was really folded into those. At the time, we didn't really know yet what might be required of us in terms of evaluation or reporting from the state. And so now, in lieu of having outcome reports from these organizations, and in lieu of us having our longer term strategic priorities yet, we're really looking for objective areas to kind of do some cross comparison of the funded programs and try to figure out how were the funds utilized, were they able to be utilized as intended, et cetera. So really we started by looking at spending patterns, really as a means to provide some insight into which programs are able to use their funds as they were originally proposed and approved by the council last year. This is a bit of our early work, just sort of providing a snapshot of some of those spending patterns. So first thing we did is we looked across the programs that I identified originally that they only needed one-time funding. And so those programs were taken out. And then we looked across the remaining programs for just trends and how they've been spending their dollars. And you can see a breakdown. This is reporting as of Q2, so July 15th is really what this is representing. We don't yet have our reports for Q3, which will come in October. So keeping that in mind, this is where the programs are currently sitting in terms of their spend down for the dollars that they were originally awarded. Slight caveat on the 100% number as well. Some of our programs did request a one-time lump sum, just because what they were requesting funding for was an upfront one-time cost. So for example, the sheriff's office, some of those licenses that were requested, that's a one-time fund. Public health also requested some upfront funding to launch and develop some materials for a public awareness campaign that the council approved. So that's why you'll see some of those programs represented in the 100% having already been spent or allocated. One thing I also wanted to mention is that as we looked across the variance in program spend, it was really a lot of it had to do with staffing. So if you can recall, a lot of these programs were requesting FTE or sustaining current positions. And because of our contracting process being a little bit slower than we thought it would be, some of our programs didn't receive their dollars until almost May. That said, they have not yet been able to spend as according to what they thought they would be able to, and a lot of that has to do with just getting staff on board. So what we did with this is we developed a little bit of a methodology here, a process to figure out how to continue funding for our programs that are currently funded. First part of that process is looking at current spending trends that I just showed as an indicator of whether the dollars are being used as originally intended. The second part of our process that we'll be doing throughout October is really meeting with each of these programs to get a little bit more information and interviewing them to ask what's intended use of additional dollars, what is the continued need, just get an understanding of where those dollars from the first funding drop went. And then with that information, we would be extending funding to any of the current programs that express they're still in need. How we would do this is basically total the 3/4 of their current spend and then project out their 4th quarter of spend and then extend that amount up to the original award amount to programs for an additional year. So a little caveat there is programs we would allow to make a slight adjustment to their original award amount if FTE costs have gone up since last year, but otherwise we are not having continuation funding be about expansion or extending any additional funds outside of the original awarded amount. And then the third part of the process would be that as we create these funding agreements in the second round, that continuation funds would just be one additional year, and that we would let programs know that we'll be folding in additional reporting requirements moving forward. And that at the end of that year, programs will be welcome to join any other direct or competitive bid funding processes that we will have created in the next year. I'm gonna pause. Yeah, I'll actually pause and see if there's any questions on that part. Okay. This is just, oh, go ahead.
Sorry, just a quick question. The competitive bid processes, is that going to be applied across the board, or is it for a certain threshold, or?
Good question. So I don't think we have it figured out quite yet. We do know that we had talked about competitive bid processes in a council a couple months back. And the feedback from the group was to have sort of a hybrid approach. So some programs would be more of a direct funding approach if they're an identified priority that the council agrees needs to be a broader investment. And then we would also offer a pool of dollars that are through a competitive bid process. I think we're looking at a both and just trying to figure out what are the variables that determines whether a program would be eligible for one versus the other.
Lexi, I'm not sure if this gets to your question, but that's separate from this continuation funding process. So the idea being that as we work with the consultant and get more feedback from the community about strategic areas that we should be investing in, those would then, as we determine what strategies we want to invest in and get kind of support from this group, how do we then go about distributing those dollars? Do they go out through an RFP? Do they go out through some directed funding? Because there's maybe one entity that's capable and only one entity of doing that work. So that's the second part of the process that hopefully is more future oriented and much more strategic.
Thank you.
I think I've been trying to digest this slide and what you just said, Kelly. I think I'm not getting what when we go from number 2 to number 3. So are you talking about an additional year here, or okay, all right, because I was hearing extending the original 3/4 of reporting and projected for, okay, I see. All right, so that you're going to use that projection of 4 quarters for an additional year.
Right.
Okay.
Right. So oh, go ahead, Jim.
So to make it really, I think, simple, Claire, if an organization it got a $50,000 grant and they've only spent 20,000 of that, what we would do is say, well, you're going to take forward 30,000 next year. So we'll add 20,000, since that should look like an annualized budget of $50,000. So it's really carrying over the money that's left over from the first year and adding to that the amount that should make them whole as an annualized budget.
Oh, okay. That's great. That makes it very simple and concrete. Thanks.
So yeah, so hypothetically, if a program has actually by the end of the year spent all of their dollars or are projected to spend all of their dollars, we would extend that same award amount because that would be their annual amount. So it would only go up to that amount that they were originally awarded, except for rate increases.
Makes sense.
Maybe I more complicated it there. Okay. I'm going to move us forward. And this is just sort of a list of some of the questions that we had intended to ask, just to dig in a little bit more with programs and get an understanding of where their funding has been spent, where they've run into some barriers with spending money, have they been able to stand up or sustain the programming that they originally had approved by the ROC. So just to get a little bit more information about where their dollars have landed to date. And I recognize maybe I should have put this on the last slide so you could see those questions at the same time, but some discussion for the council is just, are these the most relevant type of questions about current spending and current outcomes from programs that you all would like to hear? Or are there other questions or outcomes that you would like to have funded programs speak to in these interviews about where their dollars have been spent?
Kelly, maybe you want to pop back to the last slide, and that way we can see those. Yeah.
Kelly, I wonder if it's if there's a question related to so if people are going to get continuation funding for the program that they originally wanted to do, you know, things can change. There can be emerging issues, or when you start a program, you learn from the community, or you learn something new that you didn't anticipate. Would they be, I wonder if that's a question. And then I wonder what, if they said, look, we'd really like to adjust the program, same amount of money with this adjustment because of this new issue. Would that be allowable for the continuation funding?
I would say that's probably a question for the council to weigh in on. I think for me, if we're hitting that same marker, that same dollar amount that was originally approved, I think that's really the guidelines we're trying to stay within for continuation funding. So to the extent that the scope of a project has changed, I guess we'd have to think about whether the intervention has changed so much so that it is worthy of going back to the council to say, is this still something that we approve of spending? I don't know if that would happen, but I think that would probably be a conversation for this space.
Yeah, and I kind of heard two. I'm sorry, Claire, go ahead.
Oh, no, go ahead. Yeah, go ahead.
No, I was just going to say, I think I heard two kind of levels in there, Kelly, correct me. One is like, you know, were there pieces missing that you just didn't anticipate? It's still the same scope, as opposed to it, you know, maybe your scope has actually been re-envisioned, which warrants coming back to the council. Is that what I heard?
Yeah, that's what's coming up for me in terms of what would distinguish whether or not we can continue to fund versus maybe that's a conversation for the council to weigh in on, that if this scope has significantly changed.
Yeah, I think I would like that asked as a question, because I think we want to learn from the experience of these grantees. And that learning should come back to the ROC that will inform future decisions that we make. So ask the question, see if there are items that come back to the ROC just for our learning. And then I like how you framed that, Lexi, in your response, Kelly, about if the scope has so wildly changed, then yes, that should come back to the ROC for the continuation funding. Claire?
Yeah, thanks. I think I don't have comments specifically about these questions, other than perhaps as we now turn to the question about longer term strategic planning and expenditures. Maybe there is a question we can ask that will help us understand whether this program or this expenditure fits within a longer term approach. And then I'm also, I guess, wondering about how we're going to balance the funding that we provide between these uses. And I realize you're suggesting 1 year of continuation funding, but you know, just whether now is the time to start thinking about that, given the finite amount of money, like how much of this should be dedicated to these immediate response, quick out the door expenditures, and then how do we begin to blend that into our future long-term approach?
Yeah, I think it's a great question, and I think blended is probably the perfect word that comes to mind. I think what we're trying to do by making these a year-long extension is really kind of merge them into the process that will be taking place in that year to develop some of those longer term strategies, like you mentioned, and then some of the other processes to fund some of the programs, whether they be direct versus competitive bid that Jim mentioned. So as we start to stand up some of that different structure, to maybe have that 1 year just be the holding, like kind of the container that we know we'll be able to revisit these programs in the future and see if they're still in the right spot and if our continuation strategy still works, or if we want to do something differently. Yeah, Lexi.
Thanks. Yeah, this is a really helpful conversation for me. I'm wondering to what extent, especially given some of Jamie's comments today, it makes sense for us to use the framework that was developed through the behavioral health roadmap, which, you know, includes this work, right? Because this is behavioral health. And I mean, I guess it's possible that there's something in that roadmap or that framework that we would, or there's something that could be funded through opioid settlements that would be important that's not represented in the framework. But I wonder if it might be a way to test the roadmap to try to see if there's alignment there, given that we are trying to kind of create something that really is holistic and balanced, and given some of the flexibilities that Jamie mentioned.
Yeah, I think in terms of moving forward in a more strategic direction, the idea is to bring together multiple sources of information and use that to help drive our thinking about where we ideally should be making investments. So part of that certainly should be, as you're saying, the roadmap, since that has so much information that's specific to our community. Other areas that probably will be helpful is just looking at the data and seeing, are there particular populations that are reflected in that data where we want to make sure that we're putting money toward. The Johns Hopkins stuff, if we want to get the award, we want to focus there too. But there are multiple sources of information, including how do we bring in community voice in a way that we see whatever we come up with strategically is really resonant with those voices in the community. So I think there are lots of different kind of levels of information and textures of information that we'll want to bring together with the aid of the consultant to come forward with a more strategic approach and perhaps a little bit longer term approach to trying to affect the impacts of opioid use in the community.
Great.
And I think, Claire, just to follow up on your point, I think the hope is that we have this slate of organizations that we're currently funding. To what degree do those also continue to reflect what comes out in the strategic planning process versus what might fall away because maybe it's a little less of a priority in the larger scope of things in terms of how we're thinking about using the funds.
Yeah, that's exactly what I was thinking about and why I asked the question.
I guess the other question that I have is, am I reading this correctly that the intention is to have clarity about those longer term investments by the spring? Is that right? Or am I not understanding that quite right?
So longer term investments for the region?
Yeah.
Yes. So, and that's not to say that we won't have space to continue amending the plan and developing longer term strategies, but that is really the timeline that we're aiming for. Just because we know we have that amendment period in March to say, hey, things have wildly changed since we started this process. And we actually really want to move our dollars into different places than we originally said in November. And we'll have that March 15th time to do so.
And would the intention be then to distribute those longer term funds before 2025?
That is a good question. I am not sure I have the answer to that one. I think right now we've really just been focusing on what is it going to take to get the dollars out for currently funded programs. So I think as we start the strategic planning process, that's where we're going to have the discussions around, do we want to have set aside for continuation funds on an annual basis? Or do we want all of these programs to sort of merge into a broader process where there's both directed funding options versus competitive funding options? So I think all of that milieu of like how these dollars are going to go out the door after the continuation funding will largely be determined by what comes out of the planning process, because then we'll be able to sort of see these are the longer term elements that we have. And, to Jim's point about directed versus competitive funds, are there only one or two agencies that could really do some of these broader long-term investments? So some of those questions are things we won't really know until we dive into this process.
Thank you.
But I would say, though, that there will be certainly opportunities to make some investments. And depending on how clear we are about certain areas that we want to make sure we're investing in, those might happen sooner than others. I think we went into this first process with this kind of very concrete ask. It was one point in time. And so then we are kind of in that process for those grantees. But moving forward, it's going to be a lot more fluid. We have a lot of flexibility in how we spend the dollars moving forward. And it's not as if we have to come up with one master plan that says this is how we spend all the money. We can decide, hey, this is a really clear need. It's emergent. We've got to focus here. We've got money that's set aside in the cost system to address that issue, let's get an RFP out to get those services going. So I think we'll have a lot more flexibility in terms of how we approach spending the dollars now moving forward.
And as a reminder, these funds do roll over. So while we've really kind of structured our conversation to date around shovel-ready programs and continuation funding with these kind of known timelines, you know, we also know that this next year is going to be sort of a windfall of dollars, and that it's going to be something where we're going to want to stretch those dollars into subsequent years. So we have these different sort of processes for different arcs of funding. So to Jim's point, it gives us the opportunity to kind of draw down dollars and have other opportunities along the way. Yeah, Lexi.
I'm sorry. I think I had a light bulb moment, which was, tell me if I'm understanding this. Between now and March, we're coming up with, these are the areas that we want to fund. And then after that, there's an RFP process for actually awarding the funds. Is that right?
Yeah.
Okay. But you wouldn't expect proposals before March. Okay.
No, because I think we're really aiming for March as like, okay, now we know exactly where our dollars are going. We've got it a little bit further into that programming level, which is like one subcategory down from those broader levels. We'll still have the ability to move dollars because you can amend at different periods. But yes, that's really kind of our compass that we're trying to move from in terms of, okay, now we know what we want to spend on. Here's our opportunities to get RFPs out the door. Jim, Robin, correct me if I'm wrong on that.
I would just say there's nothing magical about March, and that if something between November and March becomes very clear to us in terms of a funding need or strategy, it's possible for us to move dollars out to address that need. So March is, I think, a nice time frame in terms of it gives us enough time to work with the consultant to begin looking at a broader strategy. But again, I think if there are emergent issues that happen between November and March that either come to the attention of this group within your, the areas that you're working in, or they emerge because all of a sudden there's a new substance being used that we need to address in some way. We have lots of flexibility about getting dollars out the door. But of course, we would do that in consultation with this group.
Thank you. I think I understand better now.
Okay.
Jamie, I see your hand up.
Sure. I was just saying, per Lexi's comment, I did notice that on the behavioral health roadmap, I was just going through it quickly, and I do think there's a lot of overlap between what you have in your roadmap and what could be considered allowable uses. And so I think, because there is a little bit greater flexibility, the intention is not to cause a siloization of these funds. We know you're already doing a lot of the work here. And I think with that in mind, to think through if there is a way to build into the existing infrastructure, or your plan. It looks like there was a lot of community involvement in that as well. And so I think that's just one thing we have kind of seen is like not to have paralysis analysis. Like I know you already have some really great plans already out there and information. And I think a lot of what is included in there could be considered allowable too. So also, I think the work you're already getting the money out to, like some of these smaller nonprofits, is really great too. So of course, that's for your regional council to determine, but it looks like a really great roadmap, and it's nice that you've done that work.
Yeah, and it's a good reminder to use that feedback from that broad community engagement and not continue to go back out to the community and ask them the same questions when people have already provided information that we can act on. So
Right.
Thank you for that, Jamie.
Sure thing.
Claire, I see your hand up.
Yeah, well, yeah, and really just very simply, it seems like we're really starting to talk about the remaining topic that we had here on the process for determining long-term strategies, and I wonder if we want to wrap up this discussion about continuation funding and and get back to Kelly for what she'd like to walk us through for the remainder of the agenda, because it seems like the two conversations are melding together.
Yes, definitely.
Absolutely. I'm happy to move us ahead. If I can. All right, so last thing we wanted to talk about is determining our long-term strategies. And as a reminder, we're really, we have a contractor coming in to help support this work shortly, but we still wanted to make most use of our time and our resources with the operations group. And so we did get started, kind of dipped our toe in the water of developing our understanding of what are the priorities that everyone on the operations group at least sees as a top priority for the region. So we did this via an exercise that went out to the operations group. They did it this past 2 weeks. It started with staff categorizing all of the approved use spending areas, that the full list that Jamie mentioned in Appendix A of the MOU. And we had mentioned in August that we did some work internally to sort of categorize those into a more digestible number of service categories or intervention categories so that folks could look across them without wading through 76, 77 approved spending areas. So what this exercise was is we took those 11 theme areas and we asked our operations group members, we said, if you have 100 points to allocate across these 11 categories of spending or theme areas, how would you allocate those points based on priority? You can only ascribe up to 20 points for one particular area. And for any of the areas that you have given points to say, yes, this is a priority to me, then we had them also expand to see the list of strategies or approved uses that were nested under that area, and then vote for their top two within that category. So these are just some high-level preliminary results of what came out of that exercise. So you can see that operations group members did vote for prevention, general treatment, as well as treatment in the criminal justice space, recovery, and harm reduction, sort of our top 5 categories in that thematic area, that theme level, the higher level. Really what this tells us, if we go into looking at where the votes fell as well at the strategy level, folks were pretty much voting for the broader language, more, I don't want to say blanket, but the broader types of strategies and categories. So, one thing that came up for Tucker and I as we were looking at this is it makes it relatively easy, I should put air quotes around that, to allocate our dollars across some of these broader categories that we're going to be asked to allocate them across in the cost system for that November 15th deadline of our plan submission. I'm not going to go into this because we're a little close on time, but I pulled those top 5 that I just mentioned in the theme level, and then also carried forward the top 2 strategies that were rising to the surface within each of those thematic areas from the opioid operations group feedback. And so what's next with this exercise? We recognize that this is just one drop in the bucket in terms of trying to determine what's our longer term strategy and what's our temperature check on where our priorities lie as a region. So this is going to be a continued conversation with our operations group actually tomorrow. So we're a little out of cadence. We're meeting with them tomorrow instead of before today's conversation with you all. But this is what we'll be asking in that conversation. How do you think your chosen themes and strategies are reflective of a comprehensive strategy? What guided your selection of these choices? And which approved uses, as you went through this exercise, did you find yourself needing or wanting to know a little bit more about? And really wanting to understand more to help inform your decision. One other thing I will note quickly is that we're also going to have a conversation tomorrow with the group about what areas of expertise need to be represented in that group moving forward for additional strategic exercises of this nature. And should some of those areas of expertise be one-time, such as when we're doing some of these prioritization exercises, or should we fuse them into permanent roster members on the operations group? So we'll be talking about that with them tomorrow. I'll pause and see if there's any questions on that exercise.
Kelly, I wonder if you've already thought about doing this, but it seems like mapping the results of this exercise with very similar work that was done for the roadmap around the opioid and substance use area would be helpful.
Yeah, absolutely. So the roadmap has come up quite a few times. Originally, we were trying to do a crosswalk of some of the relevant recommendations from the roadmap and fuse them into the exercise in advance, but we didn't quite get there. But Tucker is very much on top of doing a crosswalk to make sure that anything that's kind of surfacing as priority area, whether it's at the thematic level or sort of those nested strategies therein, that we're doing a crosswalk to make sure this has been validated or where it falls into the community feedback from the roadmap process. And I don't know, Tucker, anything more to add there?
No, I think that you're totally right that the roadmap has come up a number of times, and just like Jim mentioned, one of the things that we're looking at is how we can overlay a number of different resources to really guide our thinking. And so I have on my to-do list next week is the roadmap overlay kind of review week, hopefully.
Thanks, Tucker. Whoops, my button doesn't want to advance here. All right, so what are we doing with this information? So as I mentioned, this is just one ingredient of many ingredients that's going to go into developing our priorities. We do plan to supplement this and offer additional evidence-based crosswalks of white papers or evidence-based, such as the Hopkins strategies and the roadmap that we've been discussing. And then most importantly, taking this out into the broader community once we have a bit of that facilitation assistance from the contractor, and having the operations group respond to and lend subject matter expertise to any of that community input. So really trying to create ideas a little bit more at that community level, and then utilize the operations group really as that lens of subject matter expertise to kind of figure out how do we put this into our strategic methodology and then create recommendations that would go back to you all at the council. So that said, this does bring up a slight shift in roles. Again, this is primarily being proposed to incorporate a feedback loop or an advisory loop really from the community itself. To make space for that feedback, we are proposing that idea generation comes both from the operations group as well as community convenes in tandem. And that anything that the community surfaces in terms of strategies, approaches, experience, other key funding ideas that they'd like to fold into the conversation, that then moves into the operations group, where again, we apply a little bit of that lens of subject matter expertise, any of that additional methodology that the contractor has helped us develop, sort of mix that up, and then create that into a refined set of recommendations that would continue to come back to the operations group, or excuse me, the council. Whoops. This is just a handy dandy little visual of everything I just said, which is essentially the ROC, generates ideas, the perspective of constituents, local issues, local needs and investments. The community similarly generates ideas for investment generates ideas for proposed investments, but also has a little bit more of that voice, that life experience, that proximity to what's really happening in our communities. Both of those come into the operations group, subject matter expertise, community input, and council priorities taken together will create recommendations for funding moving forward with the ROC. It's a pretty rudimentary sort of modeling of how our kind of three bodies can potentially sort of work together to highlight investment areas and then sort of put them through additional work and methodology before we put them forward as solid recommendations for funding. And some conversation for the council. So I don't know if this does, but does this idea of the three bodies sort of working in tandem, does it shift your understanding of your role as council members?
I think for me, it just reminds me that we're in a developmental process as a board, and I'm really eager. We got some really helpful feedback from the City of Boulder staff around matching the ops group work to our agendas. So there's a connection there. And we talked a little bit about that at the last ROC meeting. So I look forward to that happening as we get caught up in our developmental phase. So I think this is on track. Yeah, and let other people weigh in.
One thing I might offer, just because this kind of stems from conversation in August, we heard from the council just as a desire for a little bit more context information, sort of building a baseline of awareness and knowledge around the opioid epidemic in general, the abatement process, et cetera. So that last question is a little bit more for guidance to us. You know, if we did provide additional information, white papers, database presentations, or presentations from other regions, what's your best hope for that? What would that look like? And what's the knowledge base that the council is hoping to build out? Should we bring more of those things to this space?
I'll just pipe up here. I think on that last point, I would really like to see that because I think for me, what it would achieve is perhaps the ability to go out, be more proactive in seeking programs and services that may not be coming to us, or that we may not readily think of. And I guess as one who always feels more confident in my decision making when I know that I'm informed and that I'm not just coming from a lay knowledge base, which is really what I have here as a commissioner. I think it's going to help me just think more creatively, and as I said at the beginning, just think about what kinds of programs might we fund that aren't really readily coming to mind.
That's great. Thank you, Commissioner Levy.
Well, I wonder, Kelly, since we're almost out of time, these are questions we're going to continue to get feedback from the council about. And maybe it's council members, if you have other reflections or answers to these questions, to send them to Kelly, your answers, and then she can combine something to put in our packet for our next month's meeting, unless people have any final comments for today.
Just that I find it super helpful when you're able to kind of curate a little bit some of the information, just knowing how busy we all are, particularly in terms of, just lifting up, best practices in other places that maybe aren't on our radar, or, some of that. I mean, we may get to a point, I hope we do get to a point where we're really thinking as a region and looking at each other's plans and where are the opportunities for collaboration. I know at MDPH on Friday, we're going to be talking about the opioid plans, but just kind of, where those opportunities, along the same points that Claire was making. What are we missing? Recognizing that the regional approaches can be so beneficial, both in terms of scale and efficiency and effectiveness.
Well, you bring up a really good point too, that each of us have those other connections with other counties or professional groups. And so to do our own intel and bring that back to this meeting, it would be really great.
And I'm of course happy to share whatever I hear Friday. Tomorrow. Otherwise, no, tomorrow.
All right, I think that was it for me. So Robin, if you want to close us out.
Yeah, and I'll ask Commissioner Levy to do that. And thank you so much, Kelly, for the great work and the great presentation. Commissioner Levy, do you have any closing remarks?
No, I think it's all been said. So I'll just
Okay.
thank everybody for their time, and especially thanks to Jamie and Jack for joining us this afternoon.
All right.
Right.
Thank
all
you,
right.
everybody.
Right on time. All right. Have a good weekend,
Okay.
everyone.
Thank
Bye.
you. Bye.
Bye, everybody.